and masking on what happens with our ICU capacity. And this is being done based on a and if you look at what happens when we are impacted by the Delta variant, we see that those numbers go up dramatically. Previous slide showed numbers in the 1,100 range at the peak. If you look at our Delta variant, you see that the number is much higher, somewhere close to 1,900 or thereabouts. And when we start implementing masking and other non-pharmaceutical interventions at a moderate to high compliance rate, we see that the curve flattens. And with high compliance, we see that there's, we're not overwhelming our ICU capacities. And that is true with school starting with masking. And it almost is lined up with not having school opening. So we see that masking really does impact our numbers significantly. And this study was using some of the data that was collected in a German study where they showed with 90% compliance, they had approximately a 50% reduction in that climb of the curve. And so I show this to show that if we do implement masking, that we can have a favorable impact on the number of cases that are impacting our ICU system. And I'd like to go back to the original slide. Which, as I said, is showing our data over time. And we see that in these two instances, we did not have the impact of vaccinations to work with. And they were just started, we just started deploying vaccines in this time frame. So the vast majority of this decline in the surge was because of our use of non-pharmaceutical interventions. There was some impact from vaccine, but largely at this point, we were vaccinating healthcare workers and our elderly. So I show this to show that masking, social distancing, hand washing, and staying home when sick are things that we've used before successfully to reduce the spread of COVID-19 and to prevent severe illness, disease, and ICU admissions to hospitals. We are now faced with a new variant, and these same things will protect particularly our younger children who are not eligible for vaccinations at this point. And I support this body's going forward with masking and contact tracing for those cases that are identified as positive in your school systems. Last year, we had 2,410 positive children identified in the ISDs, with another 1,463 staff cases. Each of those cases had approximately 10 close contacts. And because of the efficiency of identification of not only the positive cases, but the ability for the school systems to know where those children were in the schools and to be able to reach out to parents and let them know that their children had been exposed. And for those children who were exposed to be able to be quarantined at home until we could ascertain that they did not have COVID. That went a long way to reducing our number of cases in this county. we're dealing with the Delta variant, which has been shown to be much more infectious. It spreads as quickly as chickenpox does. It has a pre-symptomatic transmission rate that's been reported with high viral loads early on before a person develops symptoms. So that makes masking all the more important. And it also makes the identification of close contacts important because they will be able to be removed from the school setting, which is a congregate setting, and reduce the exposure to others in the schools. So I applaud your move towards masking, and it aligns with my recommendations and that of the CDC and the American Academy of Pediatrics and many other Texas pediatric groups alike. And my colleagues and I support you, and that's the end of my report.
Thank you, Dr. Walks. Trustees, do you have any questions? Trustee Boswell, then Trustee Singh.
Thank you, Dr. Walks. I appreciate this. I have a question about the positivity rate in 12 to 14-year-olds and 15 to 18-year-olds who are old enough for vaccinations, and also the data that you said you were seeing from spread during extracurricular activities, camps, and kind of all the things that happen before school starts with marching band, sports. I'm not sure exactly where the spread is, or if it's, camps where children are going during the day for other reasons. But I would love to understand the relationship between those things and the positivity rate in populations that are old enough to be vaccinated, and what that tells you about how we can keep those students safe as we return to school.
Historically, children have done well when they're in school or when they're with parents that are guiding their choices. But in the teen groups, particularly if they get away from the supervision of adults, we have seen peer pressure impact their choices, and they may end up wearing a mask when they start off in a given situation and then remove their mask. So some of that comes into play. And then this also is showing that we don't have enough of our children that are eligible for vaccinations vaccinated yet. So as we move towards encouraging not only our friends and family, but our colleagues and others to move towards getting them, not only their kids, but themselves vaccinated, I think that's going to help improve those numbers.
Thank you for that. And when you talk about compliance is higher with all the protections when adults are present, is that the curves that you showed us about the masking, schools with mask, without mask, and as compliance goes up, the curves flatten?
It's not, I mean, that does speak to compliance. But again, it really is a matter of guiding choices. And it's when you're in a situation where you don't, it's part of the rules, you have to wear a mask, it's going to be a lot easier to get better compliance with mask wearing.
Thank you.
You're welcome.
Trustee Singh?
Thank you so much for this excellent presentation. I have a few questions. Would you mind putting that slide back up that showed the number of pediatric patients that were in ICU? Thank you. And I just realized I can't see it because I don't have my glasses. But would you mind, so I think it was showing June, like last month versus, it's showing June 21 versus July 21. Is that right? Okay. I was
Yes,
curious
ma'am.
to know, is that the highest that we've seen in, during this whole pandemic? Or was it higher at previous times, like around Christmas of last year?
I don't have those figures in front of me, but to my knowledge, this is higher than we've seen in previous surges.
Okay, I appreciate that. Thank you. And
You're
then when we had Dr. Myers come and speak with us a couple of weeks ago, I believe she had shared with us that only about 40% of 12 to 15-year-olds have been vaccinated. I wanted to know if you happen to be tracking that as well, and if there are any updated numbers.
I don't have the vaccination numbers with me today.
Okay. And then I've had a lot of parents asking and being concerned about long COVID. So even though we see there's an increase in hospitalization, would you be able to share a little bit of what you all are seeing here in Austin with regards to long COVID and the risks for that? And even what that phrase means? We don't have enough data right now to make a determination on what the impact is going to be on our children overall. And the term long COVID is something that we're seeing not only in pediatrics, but we're also seeing it in adults. And it's manifest by things like chronic fatigue, memory issues, joint pains, some prolonged sequelae of shortness of breath, or getting and problems with lack of endurance. So it's going to take some time for us to gather the data and really quantify what that means and whether it's something that's associated with children who have some underlying medical conditions and what those might be, or whether it's something that's unique to the viral entity itself. It may come down that it's a combination of the two things. So unfortunately, this thing has been evolving faster than we can stop to do the gathering of data and really drill down on what everything is that we're gathering and what it all means. Thank you. And I know, obviously we heard from the callers today a lot about masking. You've mentioned it as well. In our district, we have, I think President Rodriguez has said, we have 17 different layers of protections that we're implementing to keep our students and staff safe. So would you mind sharing where masking falls in into the effectiveness of all the different things school districts could be doing to keep students safe? From what I've heard, vaccinations is the number one thing, but beyond that, what would you if you had to rank different interventions?
Well, the first thing that's going to be most effective for any individual is to not be exposed to the offending agent. And that's all we had when we started our fight against this virus. So ultimately, protecting yourself from exposure is key. We now have the use of vaccines to keep from being infected by the virus. And that's going to be great for people that are over the age of 12. But in the meantime, we have to protect those who are younger than 12 by decreasing their level of exposure, and that's going to be achieved by masking. So it depends on your risk. And in this case, the risk is highest for those who are under 12. and because they cannot be vaccinated. So for them, the number one protection is going to be masking. And not just their being masked, but for those who are around them to be masked. We've heard guidance from the CDC stating that if you're going to go to a home where somebody is immune compromised and unvaccinated, that you should wear a mask. And we need to protect our children in such a fashion by being masked around them in case we're asymptomatic carriers. And we need to put masks on them as well so that they can be protected from exposure to COVID-19 Delta variant.
Got it. Okay, well, thank you so much.
You're welcome.
Thank you, Trustee Singh. Trustee Lugo?
Thank you, Dr. Walks, for this information. I do have a question that I'm not sure whether you would be able to address or maybe point us to some information about. But some parents of younger kiddos have said, well, my child can't breathe with a mask. Now, I myself have a 3.5-year-old, and all she has known, all she can remember, is the pandemic. And at her
Excuse me 1 second. Let me close my door. Just a minute. Sorry.
No worries. So all she can remember is the pandemic. And she wears her little mask fit to her face. And she and her little classmates, who range in age from 3 to close to 6, wear their masks faithfully every day when they're in class. And so could you help me, maybe point me in the right direction? What does the research say about children and whether they can breathe with masks on?
They can breathe with masks on, and but if there's any condition that precludes their doing so, either they're too young, less than 2 years old, or they're unable to remove the mask, or in this case, it sounds like this child has some anxiety about it, but it's hard to say. Then if that's the situation, then that individual may not be able to wear a mask. But, without knowing what the situation is and assessing it, I can't speak to what that particular situation is based on.
So, yes. So thank you for that kind of general response. And I think one of the things that you said that sticks out for me is that by and large, unless there's a health condition or some other extenuating circumstance, then by and large, children can wear masks and breathe through them. Is that?
Yes, ma'am.
Thank you.
Yes, ma'am.
Thank you.
You're welcome.
Thank you, Trustee Lugo. Trustees, any other questions? Trustee Zapata.
Okay, excuse me. My question is around what you stated about a lot of children or young people that that got COVID during the summer was when they were in extracurricular activities. So, do you think? We want our students to participate in extracurricular activities. With this new virus being more severe, is that something that we need to consider, extracurricular activities only happening on their campus and not in big crowds? Because we will not be able to control everybody else that attends those football games or soccer games or any of those things.
We certainly are it's going to be a challenge. I think that the previous trustee mentioned that her daughter's habit is to wear her mask and make sure that it's fitting correctly. It's going to be creating a culture where that's the habit, and the norm until we get to the other side of this surge in this particular part of the pandemic. And so a lot of it's going to be not only requiring it, but instilling it as something that's part of the everyday cycle. Just as we're talking about making sure that we take breaks for hand washing, and heretofore we used to talk about covering coughs. Those became habits, and the proper use and wearing of masks is going to have to become a habit that doesn't require supervision.
Okay, thank you for that. Can you explain what you mean by contact tracing?
That's a process by where an individual who has been identified as having an infectious disease that's communicably transmitted or transmitted in our community is identified, and then we identify who has been around that person in close contact, which is defined as 15 minutes during a 24-hour period within a 6-foot distance. And those people that have been identified within that definition are contacted, and they're informed that they've been exposed. And then because of that exposure, we ask them to quarantine for a given period of time to see that they have not, that exposure has not caused them to be infected by the disease in question.
Okay, so you have the database of everyone that's already been infected?
It's reported, yes.
Okay, great. So if we have any new outbreaks in our campuses, you all get that information and follow to make sure that that's happening? The contact tracing is happening? Y'all do the follow-up?
We do receive the information. However, we receive reports as the data is entered, as the data is transmitted to us, and that causes a delay in the initiation of that contacting not only the case, and then we have to contact the case, and that only happens maybe 40 to 50% of the time because people don't answer their phones or they're not available for whatever reason. So our contact tracing happens only as much as people pick up the phone and answer. And then they have to be willing to answer the questions that we're asking. Mm-hmm. So for us to do the contact tracing, yes, it is possible. However, when contact tracing is done at the schools, they know where the children have been. They know the classrooms that they've been in. They know the seating assignment. They know who's been sitting around the child that may have gotten sick. And that expedites the process. If we do what we did last year, we will be much more effective in containing the spread of COVID-19.
Well, that's very helpful. I think that's helpful for all the community to hear, and especially what you said, if people answer their phones so that we can get all that information of data, which is very important. Thank you.
You're welcome, ma'am. Thank you for the question.
Thank you, Trustee Zapata. Trustee Singh?
I have one more question. And again, thank you so much, Dr. Walks. We know that you have a very busy schedule, but I think probably one of the most important slides that you had was the one that showed the ICU capacity with different levels of compliance. Can I trouble you to put that up again? Because as we, as trustees, make decisions about layers of protections putting in, I want to have a really clear understanding of what impact the compliance level would have on the ICU capacity. And so I know we kind of whizzed through that slide a little bit, and I was just hoping that you could kind of talk through it just for about a minute or so with the, yeah, I think it may have been that. Yeah, it was one of those two.
So
Yeah, what are the main
What is-
takeaways that you would like for us to have from this slide?
if we wear masks in school and have high compliance with that, that we will be able to maintain our ICU capacity.
And I hate to even ask this, but what happens in the case where we exceed our ICU capacity, like you see with the status quo and moderate compliance?
There will be an issue with being able to provide care on some level, either increased wait times or having to divert patients to other systems, not necessarily in the state, because right now all of our major metropolitan areas are having difficulties with the same thing that we're experiencing here. So we may even be looking to out-of-state locations. And if resources are limited, then we have to make
Thank you, Trustee Singh. Trustees, any other questions for Dr. Walks? Trustee Wagner?
No particular question, but I just did want to thank the doctor for spending time with us this evening, particularly with as full as your plate is right now. It's very helpful to have the latest facts and statistics, so thank you very much.
You're welcome.
Thank you, Dr. Walks. I don't think we have any other questions. Okay.
Okay.
We appreciate your time and
Thanks.
appreciate everything you do for our community.
Thank you, and thank you for standing up and having this conversation. I appreciate it. Thanks.
Thank you.
Bye-bye.
Trustees, we will now recess the open meeting at 8 o'clock and move to executive session pursuant to Texas Government Code Sections 551.074, 551.072, 551.073, 551.087, 551.076, and 551.071. For purposes of this video meeting, the board will now leave this open meeting, which will remain live online and convene privately in a separate meeting. And when we're finished with our executive session, we will reconvene here. And again, we thank our community for their patience. you.